Hi, my name is Mike Brown. Welcome to Fire Engineering Training Minutes. Today we're going to talk about patient assessment during active shooter events or high threat incidents utilizing the Rescue Task Force concept. Our patient assessments are dedicated on being able to be performed very quickly. We're trying to treat the things that are going to kill our patients the fastest, and we want to manage them appropriately and as quickly as possible so that we can get them moving. Here, Mark is applying a tourniquet to a lower extremity amputated limb. The other portions of those assessments are bleeding, airway, tension pneumothorax, and hypothermia. That follows the BASS algorithm. We want to treat that bleeding first, and then we're going to try to manage the patient's airway and monitor their breathing and keep them from freezing. So we want to make sure that we maintain their warmth as well. While Mark's doing that, I'm going to do a simple raking assessment down this patient. And I'm using my fingertips, and here my finger has come into a wound on this patient's chest that Mark's going to manage with a vented chest seal. Here, as I'm raking, I'm simply trying to find any holes that this patient did not wake up with in the morning. I want to locate any holes that aren't normal body orifices, and we're going to plug them. Anything from the neck to the navel, we're going to cover with a chest seal. You ready? Same thing down the back, clear. Raking assessment, nothing found. Okay, today we talked about patient assessment, particularly when utilizing the Rescue Task Force concept. We discussed the BASS algorithm. Remember, BASS stands for bleeding, airway, tension pneumothorax, and hypothermia. We've addressed the bleeding by applying the tourniquets to this mannequin. We've treated the airway through just basic positioning or simple airway adjuncts if they're needed. The tension pneumothorax portion of the assessment is critical for any patient with chest trauma. The vented chest seal is placed over open wounds to restore the integrity of the chest wall and help the lungs inflate. However, if air then leaks from the injured lung tissue and cannot escape, a tension pneumothorax can form. The vented chest seal is designed to allow air to escape, but it can become blocked with blood or other debris. For this reason, if the patient develops shortness of breath, altered mental status, or other signs of decompensation, a corner of the chest seal should be quickly lifted, then replaced to allow air to escape. Definitive management of this condition will require advanced life support assistance when tactically appropriate. And we would always want to keep the victim covered whenever possible to keep them from getting cold. I'm Mike Brown. This is Mark Litwinko. Thank you for watching Fire Engineering Training Minutes.